All right, we'd like to get started. Deanna. All right. Thank you all very much for staying. This is, again, one of the most important topics, and I deal with. I get calls and letters all the time from organizations wanting to find out what can they do to increase utilization. So we have two wonderful, experienced people from different experiences. So I'd ask them to introduce themselves. Juliana Perry, Director of Operations at Johns Hopkins Medical Center, and Tim Lau, Health and Wellness Manager for Gwinnett County Government in Georgia. So Juliana, would you introduce yourself, please?
Hello everyone, Juliana Perry, can you hear me? I'm Juliana Perry. I work at Johns Hopkins Healthcare Solutions, and my position is in charge of taking the many innovations within Johns Hopkins faculty and others to the commercial marketplace, including programs, risk stratification platforms, and also working with the Johns Hopkins University on their delivery of on-site clinics nationwide.
Thank you, Tim.
My name is Tim Lau, Health and Wellness Manager for Gwinnett County. We're the second largest county in Georgia. We're a government entity, and we have covered 8,000 lives. We have a health center since 2015. So 8 years we've been really trying to push utilization of the wellness program. Hearing, we get a lot of the same stuff you're going to hear, but we're just going to reinforce. With the amount of employees we have, especially if coming from a public sector, from a government entity, it's a lot different than when we're looking at a private sector. Making sure the location is correct, making sure that we'll talk about communication as well, but it's important that if you're thinking about opening a health center, a wellness center, or you have a wellness center, or you're looking for new ways to engage, we're going to try to do the best we can to kind of guide you in the right direction.
Let's start out with, what is utilization for you? How do you define that, Juliana?
We define utilization as the number of employees that are touched by the on-site clinician at the health center.
Yeah.
Utilization is a tough one because it really depends on what you want. It really depends on what you want to see. We can see everything from acute care to episodic, or are you really trying to reach chronic conditions? Or do you really want to see unique visitors? Do you want to see first-timers come in, or do you want to see the frequent flyers continually coming back? When we talk about utilization, we're looking anywhere from, I guess we're talking percentages, anywhere from, we average about 65% utilization in our actual health center. But it's important, it really depends on really what you want. If you're having primarily episodic or acute care with the sniffles or covering a rash, is that giving you a return, or are you really trying to impact employees by closing gaps in care and getting them back into the wellness center, making sure they're actually taking care of their health and actually managing their chronic conditions?
And I think it's important to note that how you define utilization, what's in the numerator denominator, how do you define a patient? And I'm going to talk about some of this tomorrow in our measurement session. But is a patient someone who's been touched by the center, someone who is eligible for the center, someone who has got most of their services at the center, someone who has a certain minimum number of visits at the center? Both you and whomever is measuring this has to decide that, so that you can decide, are you reaching the right people? So are you targeting those who have chronic disease, or those who have 5 or more risk? What's their utilization? So let's all be part of it. How important is trust and confidentiality in getting people to use the center, Julia?
Trust is one of the most important factors in the on-site clinic setting. For Johns Hopkins, it really is a relationship service. It's about the connection that the clinicians are able to make with the employee population. They are thoroughly immersed in the corporate culture, in the employees' culture, on their needs, both at the corporate level and at the employee level. And it's key that through that relationship building, they build the trust needed, so that when there is a need, the employee is not hesitant in coming in to see a clinician, understanding that there will be the confidentiality and that they'll have their best interest in mind, and that they're not really working for the employer.
Thank you.
Coming from a public sector, when we first built this wellness facility, they didn't trust us at all. Two things that we realized about employees: they don't trust the employer, and they don't trust the insurance carrier. And they basically thought, you're building this box to collect information on me, and find out how you can increase my premiums, how you can do these things against me. Why? And that's the hardest thing, because it's the number one thing you need to fix. Well, I mean, a lot of number one things, but the perception. What do employees, when they look at that building, what do the employees think that that's for? Are you communicating the right story and reaching the right population as well? And when we talk about providers, we'll probably talk about this later, providers are essential. They can make or break your facility. You always hear these great stories. I guarantee everybody who's talking about their stories, their providers are excellent. If I had Dr. Joe, I'd steal him away, so I would go back to him every day, just to get to know him. But I'm telling you, if you go to a provider and you somehow don't trust them, or you just have a bad feeling, they're not going to come back. Because just think, the number one way to gain usage in these facilities, and you've heard this already today, are referrals. Somebody has a good experience, they will tell others, and they will bring it back. If somebody has a bad experience, they'll tell 10 others. And guess what? Your numbers will plummet, and then we're starting over trying to figure out how to repair what the damage did from that actual provider.
Thank you. Joanna, how important is culture in increasing utilization?
Culture is extremely important, and one of the key things that we have the practitioners get in touch with. Again, every organization is different. We work with employers that are blue collar, white collar, manufacturing settings, global firms, and they all have different styles and different goals. For example, one of the speakers talked about their employees being engineers and wanting to get back to work sooner. There are other settings where the employees would rather, go to the clinic and try to see if they can take an extra 15 to 20 minutes. So it's really important in setting the right expectations so that we know how to better manage the employees and their health.
And for us, for a government entity, I think Stacey mentioned this before, we have 20% of our population are first responders. So that's 2,000 first responders that we actually deal with. We have, like I said, our population is over 1 million in actually our county alone. So we have 8,000 employees who look after those who take care of everything. So when you talk about the culture, you're literally dealing with individuals who literally work. Actually, I have chiefs who actually live 2 states away. And we understand that we have to project the importance of taking care of yourself and actually utilizing the actual wellness center. But you have to continually make them understand why you're actually doing this. We're trying to create that culture of health. Yes, we offer wellness programs to really connect individuals. Yes, we do incentivize. People sometimes say, why are you incentivizing? They should want to go there. Dr. Joe, you build it, they will come. Good for you. I don't know how you did it. It doesn't happen for everybody, because you have to make people understand the why. When you're talking about decision makers, if you're deciding to build a health center, or if you're thinking about what's going on with my health center, take a step back and say, are we creating the right culture, and why the heck are we opening this thing, and what are we trying to solve?
Thank you. Joanna, what are the key strategies for increasing not just in-person but virtual care?
The number one would be communication, especially on the virtual setting for those of you that have virtual or remote workforces. It's important to continuously remind the employees that the services are available, what specifically they can come in for, if it's not just health related, if there are other specific services provided, like travel vaccines, for example, wellness checkups. The second for those in-person settings is visibility. If you can have that clinic in a place that has high traffic, it's great. Again, out of sight, out of mind. So even if you build it, if it's out of sight, they may not see it or remember and come. And the third would be meeting patients where they are. It's one of the benefits of having the clinician on site. They know your work setting, they know the hours, the culture. So from having the clinician go to the C-suite and administer flu shots in there, taking just a few minutes of their time, to in other settings, going to the helipad and doing, taking the flu shots and other things there. Education is also key as part of the communication for Preventive and to continue building that relationship between the clinician and the employees.
Thank you. Tim?
The question was about virtual.
Yes, strategies for in-person and virtual care.
It's, when you talk about, in my past, I worked actually in a clinic at an on-site care site. I have a 10 years experience doing that. And then I worked with the actual, from the vendor side, and then supported multiple clinics. So I see how virtual can impact and how in-person and how those actual strategies work. It really depends on what you're trying to do. The funny thing is now I'm on the client side. So I understand where, when vendors come to me, say certain things, I understand from, now I'm sitting across the other table and can ask the hard questions of, wait, are we doing the right types of strategies? When I've worked with groups where they literally had, I believe it was 19 shared clinics, where from the mom and pop shops that change tires out. Obviously, you're not going to do all on site, so we have to be able to strategize to do virtual, to do these hybrid versions. For us, we're looking at, trying to reach, as big as this county is, they're having a hard time actually getting to the health, to the wellness center. Where is your wellness center located? When you have like certain types of factories and things like that, your clinic is centralized. Ours is literally, could be 20 miles away from where this individual lives. The spouses, because we do open up for spouses as well. Are you communicating with the spouse? That's something, I'll be completely honest with, that we're not doing as good. Because we need to increase communication with the spouses. We need to have a better strategy, because the truth is, spouses communicate better to the employee than the employee actually understands. We've actually heard from spouses say, I didn't even know you had this stuff. What are you talking about? You're telling me my husband could have got $750 in incentive funding if he just did a couple of steps. I also get $750. He told me I didn't have to do anything. And this is not even including the premium discount that they're actually getting of $720 a month. They're getting incentive funding on top of that and driving them to the wellness center. So going back, it is reach. You have to know where they are. You have to be able to reach. You have to understand their culture, and you have to understand what is your your population better than anybody. Think about it. How can you possibly reach it? What is the best solution to try to reach as many people as possible?
And what role do incentives have? I don't even know what employer who actually mandates their people go to their center to get benefits at all. But what incentives can you recommend?
We don't typically see incentives at the on-site clinic level. We've seen them with program participation, and although you may get a high number of participants because of the incentive, they oftentimes don't follow up with the recommended care, for example, because they got their incentive and that's all they needed. So that tends to skew program utilization and really impact the outcomes of that program.
Tim?
For me, remember, if they don't even know it exists or have never experienced it, why would they want to come? Why would they even want to go there? I mean, you think when you visit vendor booths, why do you think there's swag on the table? They want you to come over and grab a squishy ball. They want you to come over here. Why when you open up cookie stores, why do you think they give free stuff in the beginning? Because they need people to actually experience it. Because the number one thing is referrals. How can people referral if they've never actually experienced it themselves? So we do incentivize, not financially incentivize. It's part of a wellness program where if you do certain things that you can come in there and say, hey, I experienced this, or I did a wellness coaching session with a provider, or we encourage them to do their biometrics, know their numbers. I heard that said earlier, or just do their annual physicals. We absolutely will encourage them, because our population, when we talk about some of our public safety, they're so young now. It's just literally their first job, don't have a PCP. Why not create those relationships and say, hey, if you go over there, this is one of the 3 check marks that you could do to actually earn some funding that could be with you maybe when you get married and have a child, that incentive funding could be there to help you.
Some other strategy we've heard from people was make a visit to the center part of the onboarding process for new staff. Make them visit there. Make sure all the biometric testing is there. The wellness programs are there. Make sure the staff in the center visits the different departments, speaks to any meeting that's going on, making sure it's available. People with HSAs, well, they have to pay something, the employer can contribute to their account as well. So there's a variety of ways you can do that.
Also having the clinicians be part of that new employee orientation
Yes.
presentations.
Exactly.
Absolutely. New hires, safety meetings, anytime that's our thing, is to try to funnel them together and actually have them sit in the same room. So we took advantage of new hire safety meetings for like our water resources or DOT, where we had to catch them at 7 o'clock in the morning before they actually go out. Those are some of the best times. And bring the provider. Definitely bring the provider out there, because if you put a human face, if you put a human touch to what you're trying to do, it makes people feel a little bit closer to it. It makes people feel that they could trust you a little bit more. So that's a great idea to be able to do that.
Juliana, what impact does the center's providers have on utilization, and what can they do to increase it?
Providers are key in utilization because, again, to us it is a relationship business, and you want to have a clinician that understands the person and that sees them as a whole person. They see the entirety of their health needs. Someone they build a relationship with that they can trust, and someone that can identify those secondary issues that may need referrals, someone that can follow up after to make sure that additional care was provided, or if they have medications that they're adhering to the medication. So it really is key, and I go back to that relationship building because, you know, think about the providers that you go to and that you keep going to even after you move. It's those that you really have a relationship with, that you build that trust and relationship.
Yeah.
I think I already said it's one of the most essential components to have, is to make sure that provider understands your culture and understands that they can have, I don't want to say relationship, but a good patient-doctor relationship that they can create. I've seen facilities almost as big as this room, beautiful, 6 exam rooms, everything in there, and there's not a soul in the building. I've seen rooms that are big as that table, and there's people lined up on the outside because of the provider. They love that provider. And it just the amount of time, because we always say, that's another big thing too, is if you're trying to choose your provider, if a vendor's telling you, hey, our providers do X, Y, and Z, be a part of that conversation. Be a part of that interview process. Make sure that provider actually does do everything that they want. And if you're not happy with it, make sure that they understand. And I've literally worked with multiple clinics where I've actually talked to the provider. The provider is great. They say, well, you know, we always talk about, we spend extra time. We do have things. We do coaching. I have no time to do that stuff. I'm so busy. I can't have time. My focus is that. I've actually worked with providers who say, oh, I don't have time to coach. I'm gonna treat the chart and not the patient. And that's an issue. Make sure that you're treating the patient and not just the chart.
Yeah, we have employers who follow Tim's recommendation. They interview every provider that the vendor is going to bring on board, doctor, nurse, medical assistant, receptionist, to make sure they understand the culture, the benefits, they're comfortable practicing outside the 4 walls of the clinic. We have one Silicon Valley employer. He requires the clinic staff to wear shorts and t-shirts and be proficient on roller skates, because that's where their population is. They're roller skating, they're on the ball field. I mean, their average age is 26, and most of their injuries are on the ball field outside the office. But it's during work hours. So it's just critical to have that relationship. All right, so on the other side, Julian, what are the major mistakes employers or center managers make that negatively impact utilization?
I think the number one would be they feel they find a vendor and they can walk away. This really needs to be a partnership, a good relationship. We also require that the employers interview the clinicians we identify. So we vet them for their medical background, but the employers need to have a say in terms of the culture and that fit. Additionally, some employers create policies that hinder visiting the clinic, which is counterproductive, right? You can have a policy that says, if you get hurt, go to this third party. It's like, clinic on site. That should be the first thing on your policy. And the last one may be not being participants in the communication and advocates for the clinic. It was said earlier, I want to be the first patient in that clinic, or I want to be the first one to see that mental health provider. It's key that they are advocates and that they continuously communicate the benefits of the health center to the employees.
Thank you. Dan, major mistakes as employers and vendors make?
That was perfect. That's it. Thinking that you partner with a vendor and can walk away and not be a part of it. I've worked with HR staff before, like we were just told to start this. I don't know what to do. Now I got to attend conferences and figure out what the next step is supposed to do. It's a lot to take in. And making sure that partnership is there, coming up with the best solutions, making them understand the actual culture. If like I said, unfortunately, build it, they'll come. It doesn't work for us. You have to communicate. And how do you communicate? That might be another question, but communication is key. Where we have 8,000 employees, I said 2,000 first responders, and we have another 750 field staff. That means those are the guys and girls who are paying the lines first thing in the morning. We're going to email them? They don't even check their email. None of them check their email. You have to actually tell them to check their email once a month to clear out their inbox. They may not even have access to a computer. Or, we want them to use apps. I literally, when I used to work in the clinic, I had individuals who had flip phones who would literally take it out of their pockets, unwrap it in tinfoil because they didn't want the government to follow them around. And it's funny, it's true. But that's what you have to understand. Be a part of this whole implementation process. Ask questions, look for reporting that is doing what you ask. Remember the why you're doing this, what utilization, what outcomes you're trying to do. Ask that reporting monthly and quarterly basis. If it's not there, question it and find out what you can do next.
A couple other things that cause problems for not getting utilization. If you don't ask all the other vendors you contracted with, smoking cessation, diabetes management, EAP, to refer back to the center, to get the people back to the center, to have the relationship back to them. There should be soft handouts. One of the measurement points in the worksite center should be, are you increasing engagement in all your other benefit programs? Because the center should be that hub of the wheel, again, to enhance cohesion and integration, not fragmentation. Also, if you're using a navigator, like Castlight or like Accolade or someone like that, are they recommending the clinic as the first one that's easier access, lower cost for the general care? Those are all key things that you've got to take advantage of all of the partners that you're working with now and that you're paying to provide care. It should all feed back to the center. Okay, Julianne, what should be a utilization target for a new center and then for more than a true?
That really depends on the scope of services provided. If you have a center that's only focusing on workplace injuries, for example, versus a center that is also involved in the pre-employment testing, then you'll see a lot more employees. We've seen penetration rates as high as 99%. If you're providing primary or preventive care services where you do the annual physicals, for example, or whether you incentivize or not. So in the ones that we have a combination of health and preventive, we've seen in the high 70-80% utilization rates, penetration.
How long does it take to get there?
Again, depending on the setting, by year 2, beginning of year 2, we start seeing the higher penetration numbers.
That is awesome numbers. Yeah, when you first start out, I wouldn't focus on utilization so much in regards to a percentage. The idea is just to make sure that you are doing everything you can to reach the employee population. But for usually a standard for us, what we would consider successful, about 65 to 70%. Specific things, like I said, it depends on what you would look at as successful utilization. What percent is chronic condition, how much are actually following up, how many are intentionally gap closures for HEDIS measures that you're actually trying to get individuals back there, or is it just episodic or acute care? So I would say around that 65 to 70% would be good.
Yeah, I think it's important also to set senior management expectations as well as it is for you. Juliana, how did COVID and post-COVID affect utilization, and what is centers doing to get back to that?
I think the biggest way COVID affected utilization was the remote work, right? So on-site clinics, and suddenly most people were not on site. And we had to be creative around pivoting, which you mentioned earlier. So pivoting to virtual services. Who knew virtual PT was going to be a hit? Very well utilized, very well liked. And having the clinicians, for example, engage in more educational roles. So for those on-site clinicians, for example, that were licensed in a specific state, we were able to leverage their expertise in webinars that were available to the entire employee population throughout the United States, whether or not they had an on-site clinic at their location, because they were providing education. So we had to be extremely versatile in terms of how to continue providing services that were needed and how to provide the safety, that feeling of information that was needed in those times. And a lot of the services we've been able to continue providing after COVID.
Yeah, obviously everybody knows COVID changed everything from the huge spike in virtual care. I mean, virtual care, 24-hour, 24/7 teledoc services, after-hours services. We initially didn't push telehealth, but after COVID, that was the number one thing that we wanted to go after, especially for just basic wellness checkups to behavioral health check-ins. Remember, now you have to teach these providers this technology. So that's something they have to actually start learning and understanding. And I've seen beautiful setups, 3 monitor setups where providers are supposed to be using their look at it like, oh my gosh, I have to learn this technology. But to be honest, it's an incredible resource to be able to touch as many populations as possible, because you have to be able to reach your population. If you're out of reach, to be able to everybody who should be in access within your network, and that's a fail. It's important that you do create that network, that you create those opportunities. And when we're talking about just COVID in general, having a wellness center really was one of our big pushes for people for that as a benefit. And now the problem is with COVID, now hiring employees. Actually, hiring employees for government is hard, because we get resumes now and say, oh, I want 2 virtual days. Like everybody works virtual now. It's an expectation. Now, what differentiates you from what your company can offer? If usually it's around the benefits, how much retirement you're giving, how much virtual days I get immediately, right off the start. It's crazy. Oh, you're going to be working virtual. That means now we have to change our approach in regards to our clinic. Basically our clinic standards say, okay, we need to create those virtual capabilities to make sure that we reach everybody.
So we're going to have a session tomorrow on developing a click-and-mortar strategy. How has the development of virtual first impacted utilization in the brick-and-mortars?
I think it gives the ability to reach more people. And again, we talked about the importance of meeting people where they are. If virtual allows for more interactions or interactions off hours or off shift, it really has helped increase the access to healthcare outside of that brick and mortar in-person setting.
Yeah. Our brick and mortar, it took a hit. I mean, it's because of the ease of virtual care, you're basically shooting yourself in the foot. Okay, we're opening up virtual care. Now the in-person is different, but with virtual care, there's only so much you can do. I mean, you do definitely wellness checkups. You can do check-ins in regards to follow-ups, but you lose that touch and feel of being able to do a blood pressure, be able to look at the individual in the face. I know virtual EAP is great, but if you've done counseling before, it's not the same when you can sit across from somebody and read their emotions and actually read their understanding, read their voice. There's nothing that's comparable to that. How you convince the employees? You can't. But the idea is Do we incentivize to get them back in? We do the best we can, but virtual is not going away. So we have to understand our numbers, actual individuals in the building is going to decrease, but if we can reach a higher percentage of the population, it's going to be a success.
Thank you. How important is testimonials and word of mouth in gaining utilization?
Extremely important. In fact, we have a couple of employers that's how they measure ROI, in the experiences and the testimonials that their employees provide. So we make it it's part of our process to continuously request these testimonials from our clinicians. And it's tough because clinicians, save lives, that's what they do. So like, no, but tell us, what is it? Well, someone came in the other time and they thought it was just a headache, but I thought there was something else, so I called the paramedics, they took them to the ER, and yeah, they were having, a mini stroke, and they were able to be treated on time. Like, that's great. Please keep sharing those. And then also, from the employees themselves through those satisfaction surveys. And many times we get emails or that the clinicians pass along of employees, blinded and to the medical director, just thanking them for the amazing service they provided. I've been dreading these additional 40 pounds, and after speaking to you, I started walking a little bit more instead of taking the metro or the bus to work, and I've already lost X number of pounds, and had it not been for that interaction, I wouldn't have done that. So thanks, and I'll see you next week to talk about the next set of steps in my journey. So they're really important, and they have they're priceless. They're priceless in the impact they have with the employer and the relationship.
Thank you. Tim, your perspective?
In communication, putting a face on an actual employee who works there with testimony is extremely important. You can see materials that are stock photos and say, oh, we do all this. They know that. They know it. That might be great. But once they actually get experiences when a public safety person says, oh, I didn't know you did that there. I didn't know you actually had a good experience. But when you actually start seeing faces that look familiar, that's when we had the biggest impact from our intranet, from the inside, from our newsletters that we do, from our posters, from our postcard. We have to do our communication. Every time we communicate something, it only has to be 10 different things, 10 different ways to actually reach them. Everything from text message push to our in-app pushes to our wellness center vendor through their EMR to be able to do those pushes. Always putting those testimonials out on display to let everybody know they did have a good experience there, and they may actually know them. And that's especially, I always mention public safety because that is our pain point. They're the ones who they work 24-hour shifts or 24-hour shifts or 12 to 15-hour shifts. They want to spend it with their family. They don't want to come over to the wellness center when they're not home, or I'm not going to tell anybody I'm sick or dealing with mental health issues. Unfortunately, they're our highest suicide rates. So when you talk about, especially in behavioral health, and understanding that maybe you're talking to a specific individual group, find those testimonials, find those actual pictures to put a human touch on what you're trying to do can be really impactful.
What's the role of the C-suite and managers and supervisors in utilization?
First and foremost in helping with communications, helping engage the population in the variety of ways needed. Some need to do it in person, some need to do it in postcards to the house, some prefer text messages. That really is key, and nothing that we really have access to. And making sure that they have that they're champions to the clinic and the offerings as well. The more vocal they are and the more referrals they can themselves provide, it really helps facilitate more visits to the clinic or to the clinician in building that relationship and highlighting the many factors available to the corporation.
it's so big that decision makers lead by example. It's like if you're a parent, you can care less about your health or doing certain things. You think your kid's going to care just as much as you don't care. That's the thing is, in my experience, the higher ups who make the decision love the idea. The employees love the idea. It's the managers, the middle management tends to kill the idea sometimes. Say, no, you can't leave your post right now. You can't leave your desk. You can't leave your time. Even though we give you 2 hours paid to go over there without no questions asked. As long as you get approval from your manager, that's what it tends to be a little bit more difficult. So our strategy to try to fix that was to actually start getting in front of the commissioners, actually sit down in front of them, having them buy in, which is actually, believe it or not, pretty easy to do. But from there, go to the directors and deputy directors, have them understand the importance of doing this. Then hopefully they'll actually start bleeding down to say, okay, they're leading by example. My director's doing a walking meeting, or actually going in and getting their blood work checked. If one of your requirements, it sounds familiar, getting biometrics and take a wellness assessment, if you're one of them with waiting till last minute and kind of blow it off, or you say, I've never even been to the wellness center, how does that look? I mean, that's what, you might be in that position, well, the person above me just doesn't do this stuff. Well, go back to them and say, well, why do we even have this facility if you're not going to promote it yourself? It's going to make our employees healthier. Then are you healthy? That's what you have to ask yourself. And it's one of those things where they have to buy it. And that's what managers don't make decisions on. This is my opinion from my experiences. Managers don't make decisions unless it's trickled down to them and actually told to them, this is how this is supposed to happen. Or they'll make the decisions. Unfortunately, they may make their decisions on their own. And then, like I said, that tends to be contagious. Healthy is contagious. Everybody done any step challenges before in your company? Everybody gets addicted. They can't stop walking or doing water challenge. It probably annoys the people who are not doing it. But the idea is health is contagious, especially when you start from the top down.
Great. So again, in my experience, the C-suite visibility in going to the center, getting a shot at the center, being tested is key. The other thing that's worked for a lot of employers, and it's not just on worksite centers, but any wellness programs, is if you have senior managers or plant supervisors that get incentives for productivity, see if they'll get if you'll be able to build incentives for flu shots, incentives for visiting the center, incentives for the percent of their group getting biometrics. The money talks. And if they're getting a decent additional income, additional performance payment because their people are healthier, or visit the center, or attended programs, they're going to be promoting it for you. It's really key.
I love that idea. Let's do that.
Before I ask the last question, again, the text for questions from the audience is 847-606-5527. Lastly, just in general, both of you, what are the success factors for utilization? Juliana, anything we haven't talked about?
Yeah, it really depends on those KPIs that you set in partnership with the vendor and the C-suite. Are they, like Tim was saying, are they trying to close gaps in care? Are they trying to reduce time away from work? Are they trying to increase number of preventive screenings, reduce cost? All things that could be measured, and those help guide the different programs and services available at the clinic. So it really does depend on the sponsor's goals for the center.
And for the numerous clients that I've worked with, I used to oversee a bunch of clinics in the Southeast. A lot of those clients realize they're not getting a return, but their employees love going. And they don't care about the return. As long as they're having a great experience, ask any provider who's been there, they've realized they've made an impact on somebody's life. Maybe not specifically on their health, but it could be on their mental health, or just somebody to actually respond to. Like I said, we can look at specific factors on gap closures, HEDIS measures in regards to how many people are actually using it, how many people are actually coming back. But how is the overall user experience? How is the patient experience? I had a mentor used to tell me, he said, if this client would refer to say, you know what, we don't care about our numbers, but I will be more than happy to refer this, like, exactly what you set up, because of the experience our employees have, that's an actual win. Because there's so many things you can actually, I'm a huge fan, obviously, of wellness centers, but you can have the most beautiful facilities and they can fall flat in their face. You just got to take the right steps. If you have a vendor, work with your vendor, question your vendor. If you work with a broker, hopefully you have wellness consultants there that can actually guide you. There are other things where our carriers, I don't know if this is true for us in Georgia, our carriers have wellness funds. They may have $100,000 in wellness funds that they may not tell you about. You can take advantage of all that to help you with some of these costs, to help offset some of these things. They probably don't bring it up to you contractually if you don't ask. So these are some of the things and that's part of it. If you're not engaged in the implementation and the complete oversight of it, you might be somebody in this room that says, I was just given the oversight, I have no idea what I'm doing. Best thing to do is just plug yourself in those meetings and just start asking questions.
All right, questions from the audience? Got all your questions answered. Wow.
At the end of the day.
Yeah, toward the end of the day, that's true. So, when you think about the future, what do you see that the center is going to that will impact utilization, or what trends or issues or legal matters think going on? Anything come to mind?
The first thing that comes to mind is specialty. More specialty services being provided. We work with employers who want to have pop-up clinics, cardiologists, 1 month, nutritionist, another dermatologist, so that we really have the ability to impact that person's entire health, not just preventive or at work injuries, but really incorporating those specialized services, and also a little bit more of a move towards white glove, where we make things as convenient as possible for those employees to make it easier on them to get the care they need outside of that health center as well.
And that goes, everything that Juliana says, access to care. I mean, that's pretty much what they're going to do when it goes from the virtual side, and just be able to have a PCP. A lot of individuals, like I said, that I've worked with are young, has never even gone to their doctor before, or they just do what's required of them as part of the wellness product and so forth. So ease of access is essential to make sure to do it. For the future of wellness centers, I think it's definitely not going away. It's only going to enhance, especially love the idea of, with specialties, with a behavioral center, none of those things are going away. And what Larry said before is, think about all of the extra vendors that you may use, all the extra programming. They should be funneling to the wellness center. That's an absolute fact you should be doing. If you're an EAP counselor or a call center, you should have a list of all the items that they should be able to understand and actually be able to funnel them to the wellness center that they can do to save on cost. If it's for virtual or in person, it's essential that everybody's in the know. Even within, when I actually work out of the HR department, we get phone calls all the time, but only the benefits team understands, not the entire HR department. So you need to do in-services. You need to educate everybody. You need to be creating these understandings, educational books on all the services that we actually have, because by word of mouth, and like I said, that's what will help drive utilization, that will help increase it, and like I said, it's not going anywhere. It'll only expand, especially with the virtual care, to be able to reach as many people as possible.
And I think you need to look at your data for utilization. You should look at what the claims are for your medical and pharmacy claims. What is causing people to go off-site? Our research shows people who have to go to see a doctor or go to physical therapy or pick up a drug or get a medical device. They're gone 3 to 4 hours, they go home, they feed the dog, they don't come back to work. What are they going for that you could put on site? Most employers, for example, cover chiropractic services. Look at your data, look at your claims, see how much you're paying for people to leave the site for going for chiropractic. And I'm not talking for primary care necessarily, I'm talking about for musculoskeletal. If you offer chiropractor on-site or a physical therapist on-site, and not every day, but that you have this, you could save in productivity, you could save in cost, because the community cost is a lot more than it would be on your site. So as you look at your claims data and you evaluate what is currently causing people to leave, And why are they leaving? And do you have space or could you facilitate? It's like Ken was saying earlier, he's bringing a lot of mobile vans into the parking lot to do some specialty services and other services they either don't have space for or they don't have a budget for. So you have to look at your data. Your claims data should be feeding into your worksite center as well, and vice versa. Submitting $0 claims when you can, so you can see the cost of the total population. And then you can really determine what your VOI is. With that, I want to let us thank our great panelists. I want to remind you we have a reception that will be in the corridor and exhibit area. Please again complete your bingo cards for that. Tomorrow's program begins at 8:30. Try to get at 8:15 for introductions. And lastly, Allie, will you come up and talk a little bit? Where is the happy hour at 6:15 tonight?
The musculoskeletal happy hour, it's been a buzzword today, is at Cantina Laredo. If you go out to the Mall of America entrance, go up the escalator to the 3rd floor, make a left, it's around the corner on the left.